May all beings be happy. May all beings be healthy. May all beings be free from harm. May all beings love life. May all beings awaken. Welcome to another Cuke audio podcast. This is Life in Bali. I pray that you and yours are safe and comfortable, free from economic distress, and able to get out and do whatever it is you want within the limitations of the universal precept of do as little harm as possible. So today's Life in Bali, we're going to have I think it's the fourth podcast with Dr. Ida Ayu Narayani. Dr. Raya. And she was just delivering a baby earlier today and took time out to talk to us. We were going to do 15 minutes, but I ran a little over that. We talked entirely about the COVID virus, the situation here, and that sort of thing. So let's give her a call right now. That's enough of an introduction. She's, a doctor in Bali, and she's very bright.
Hi.
Oh, good. Hi there. Since you don't have much time, how are you?
Yes. Good. I'm good.
Yeah, me too. Okay.
Good.
Hey, so what's the situation now with COVID here in Bali?
So maybe you've read like the statistic in the government website. Maybe as per, I think it was yesterday and today as well, we have around 11,000 active cases.
Yeah.
Which is quite an increase, because I think it was just like about 1.5 or 2 weeks ago we have just a shy 1,000-ish active cases. So it's a huge increase, right?
Yeah.
And it's also because I work in a hospital right now, and so I see how it is in the field in terms of, like, for example, we're running on a oxygen shortage.
Yeah.
Oh, right.
No, I didn't know that.
Yeah. In Java and in Bali, we are running on oxygen shortage. So even in some hospital, it has to be, like, for example, the place that I work for, all of the oxygen tanks are situated mostly for the COVID patients.
Yeah.
We have an entire building just for the COVID patient that needs hospitalization. So what that means is that in most hospitals right now, they cannot do elective surgery, for example.
Yeah.
So surgery that is scheduled has to be delayed for we don't know how long, until all of this oxygen shortage is sorted out.
Yeah.
Right. So the only kind of operation that could be done is just an emergency, and it's mostly just cesarean section for the baby, because that kind of thing is really emergency. You cannot delay it, right?
Yeah.
So that's the kind of thing that operation that most of hospitals can do right now. Other than that, when I think it was around last week, this week also, it's really bad, like the oxygen shortage, that we have to really, really be careful with. Even in some places, they have to kind of, choose who to give and who not to give.
Yeah.
It was
triage.
It was quite bad. It was yeah.
Yeah.
But triage in a way that, okay, you get oxygen and you're not, and it's
right.
When you have to choose like that, it's bad.
Yeah.
But I don't know if the distribution chain is getting better right now or not, but at least in the hospital that I'm working for, things are pretty much the same. The ward is still fully booked, Yeah.
Yeah. Now, Kim is in the hospital in Sangla, right?
Yes, I just heard she got a AV block, third
Yeah.
degree, and she's waiting for a pacemaker.
Yeah. And
Yeah.
of course, we're in touch with that. Katrinka's on a site with her anyway. A lot of people depend on her. Um,
Mm.
so yeah, she's really down on Sinovac. uh, she's had, yeah,
She's really what?
she's down on. She is not happy with Sinovac vaccine. She deals
Oh,
with
okay.
people, uh, but all right. Now, are people who were I know Sinovac is less effective than AstraZeneca, and AstraZeneca is less effective than Pfizer and Moderna, a lot less.
It's in terms of that, it's very comparative now. I mean, it depends on where you do the research, where you do the clinical trial,
Uh huh.
because in Indonesia itself, it's the number is yes, it's like that, but it's not by significant. And although it says that the Sinovac is lesser than the others, but here's the thing about the vaccination during the pandemic, yeah.
Yeah.
Number one goal is, yes, to prevent people to get the disease. Yes. But, and it is a big but, I mean, it is a big if the people around is vaccinated enough. That's number one. If a lot of people enough get vaccinated or have the antibody from the infection, then yes, the primary goal of the vaccination would be achieved to prevent getting the sickness. But the number two, and is also as equally important, is to prevent hospitalization. What does that mean? So if someone actually got it, right, it is to prevent getting into the moderate or severe symptoms and just keeping them in the no symptoms or the mild symptom spectrum.
Right.
So they wouldn't have to go all the way to the facility and actually put a burden on it, because
Right.
look at what we're having right now. We're having shortage of oxygen.
Right.
So realistically speaking, in terms of emergency, in terms of the pandemic case, goal number two is the more realistic one.
Right.
Put it that way. Vaccination rate in Indonesia is still under 30%. Up until now, it's still around 25-30% out of the total target.
Yeah.
And we cannot compare that to developed countries like U.S. has mostly, and most states have 70%, 80% already vaccinated.
Yeah.
Right. And in that case of rate, in that case of vaccination rate, it would be realistic for us to expect the primary goal of the vaccine, which is preventing people to get the disease itself. Right. But for us, who is still on like below 50% vaccination rate, I think the more realistic goal and a realistic expectation for us to be looking forward into is preventing people to get into the hospital.
These numbers, she cited are for all of Indonesia. The numbers for Bali are much better. Right now, over 70%, and I just communicated with her, over 70% in Bali have gotten one shot, and right now she said about 27% have got the second shot. And they're concentrating on Bali, of course, because of tourism. Indonesia needs that money.
Which right now,
right. And preventing death.
Which right now we already see that a lot in people who are who turns out to get the infection. And then when we trace back retrospectively if they got a vaccination or not, most of them, yes. But out of those people who got vaccinated, they still fall into the category of asymptomatic and mild symptoms.
Yeah, and that's very important.
So that kind of effect could not be, So that kind of effect cannot be looked aside to.
Mm-hmm. What percentage of people going to the hospital have not been vaccinated?
So, in terms of that, every center, every hospital is doing their own, I would say, like counting on that. We still haven't got like the national number on that.
Well,
Research.
let's talk Bali, because national is so much different.
Yeah, it's really different, right? Even in Bali, we still don't have the number of that. I could only say from just the hospital I'm working in.
Yeah.
Let's say out of those who are in a severe condition, right?
Yeah.
Because the one that got to the hospital is the one in severe condition or moderate condition.
Yeah.
Most of them are they didn't get the vaccination because most of them are old and were not eligible for the vaccination in the first place.
Old?
When it was yeah.
But they were vaccinating old people first, after the medical workers.
Yeah, it was the time. I think it was the time when they were. Some of these people already had the comorbidity. You know, you remember during the beginning phase, there was a lot of like regulation and restriction on who can get vaccination, right?
Right.
And then, actually, you'd be surprised. There were lots of people who didn't want to get the vaccination because they were scared by it.
Yeah.
And I do see. I talked to some patient and some doctors who are taking care of them that they just skip it back then, even though some know they were eligible for it, some know that they were not eligible for it. But even those who know that they were eligible for it, they still didn't go for it because of all the news and everything. I mean, I got Sinovac as well, and I just got the infection actually, like around July. I got it with also my sister, and we both work in the hospital, and but I don't know if it's that or if it's my immunity as well. I didn't have any symptoms at all.
Now, when you said infection, you mean you tested positive?
I tested positive, yeah. PCR positive because...
Our Pembantu, our housekeeper, tested positive. Well, she got sick. She was vomiting and had a headache, and her whole family, all 5 of them, and her husband wasn't vaccinated because he's got autoimmune problem. And all 5 got it. Three kids, they're older kids mainly. Only one's a teenager. No, 2 are teenagers, but one's like 19. Katut, the husband, he did all right. He got a headache and stuff. Kadek, who was vaccinated, of course, each person's different. She got, sort of sick for a week. And she was weak, mainly weak. And they were put in a government hotel. And she stayed there almost 3 weeks. She's been gone. She's coming back Monday. She's got a certificate that shows she's negative. She's coming back Monday.
Yeah. There's also one other research that is... Sorry to cut you off.
Yeah, no,
There's
that's
also
it.
one other finding that is... not finding... ongoing trial that is being done is about the amount of doses that is actually... optimum for Sinovac to actually work, because the vaccination program that was rolled out, it was only 2 doses, right? And between like 2 weeks, 3 weeks. And now it's still ongoing, and they're trying to see if giving the 3rd dose of the same Sinovac actually doubling the antibody titer.
Yeah,
actually. So the question remains right now was it actually really effective? Yes or no? Or number 2 question is, did we give enough doses for Sinovac to actually make it work? Because apparently the 2 doses that was given maybe not enough. But what about if we inject the 3rd one, which is actually the one that is ongoing right now.
Yeah. Now, some places, including in China and Thailand, that the health department is recommending getting Pfizer or Moderna as the third injection. The Chinese, the Thai health department said that, but the government made them take it back because they didn't want to discourage people from getting Sinovac. We had AstraZeneca, and what I've read, and this is again from very reputable site, is that a Pfizer booster on top of 2 AstraZenecas, like maybe half a year later, brings your I don't know what to say, antibody count up to almost Pfizer levels. If the third one is Pfizer, it's supposed to be very effective, and I would think that would quite likely be true for people who've had Sinovac too.
I did read on PubMed journal, the New England Journal of Medicine. They were also reviewing on, topping this like Pfizer. Mixing. Some people actually like do that, right? Mixing the Astra and Pfizer and whatsoever, and they actually stated that there's no significant benefit to it. It's better to just stick with what you already have. If you have the first dose with that, and then you continue.
That's not what I've read with AstraZeneca, but of course what.
Yeah, true, but also, David, this is like, we also have to think in a scope of emergency, right? We don't approach medical and scientific journal as we did in non-pandemic time. Things are moving on daily basis. There's new findings every week, every month. Yeah. So yeah, maybe things that we are reading right now or like last month is not relevant anymore right now, and it's okay, and it's great that it's like that. It means that things are continuously reviewed, right?
Yeah.
So for me, it's like what I'm saying right now might be wrong, and I'm glad if that's the case, because that means there's some other new findings that prove that I'm wrong. Right?
Yeah. So I think somebody, there's people who don't want to get vaccinated because they don't understand the logic of the statistics. Like if they hear that a certain percentage of people who got vaccinated still get sick.
And it's understandable, right?
They make
not a very.
Yeah, they make what's called logical shortcuts and don't understand that you're 1,000 times better off having been vaccinated than not. Anyway, what I've seen so far is that getting Sinovac vaccine, especially 2 shots, is much better than not.
It's not enough.
Huh?
Yeah, much better than nothing.
No, that not enough. That's later. But if you're talking to somebody who's against getting any vaccine, we can't. I don't think talking to them about all the shortcomings and you need 3 and stuff like that. Yeah. That's just going to discourage them. Yeah. They say, see, no need to take it.
Yeah. You were saying the 2 dose is better than nothing. That's what
I think saying better than nothing is an understatement. I think it's much better than nothing. I think it's hundreds of times better than nothing. In Texas since February, from February to July 21st, 9,000 people died of COVID. 43 of them vaccinated. 43 were vaccinated out of 9,000.
Percent or 40 people?
43 people. Now, the anti-vaxxing fascist right-wing sites that are greatly enhanced by Russian bots trying to weaken America, will just come out and say, people dying who were vaccinated, right? 42 people in Texas dying. Don't take it, you'll die. You know? I know people here that only interpret statistics that way, and they get distorted, they get lies, they get distortion. But what I have seen is an overwhelming benefit from being vaccinated. Like I know a guy here and he's Indonesian. He doesn't want to get vaccinated because several members of his family got sick after getting vaccinated. Now, I would think it would be, I would tell him that your chances of having a bad result from getting vaccinated are very small, and your chances of having a bad result when you don't get vaccinated are much greater. If that's not true, there's no need to get vaccinated.
It's I was gonna say something for those. Yeah, it's really easy to draw that conclusion, right? Especially if someone gets like tested positive not long after the vaccination, and then they would just briefly conclude that it's because of the vaccination, or the vaccination doesn't work. But what they also miss is during that infection there is incubation period.
Yeah.
And if that is the case, then that people probably already had the infection before the vaccination, right? Of course, they don't know it. But during the incubation period, it is the time that the virus needed to replicate and to eventually show symptoms.
Oh, that's
later
very
on.
Interesting.
And
I hadn't thought of that.
Those are the time that people are not counting on. And because during the incubation period, it's not like the virus is giving you hey, welcome, I have landed here. It's not. It's coming to you silently, and people wouldn't normally feel that, But during those incubation periods, those are the time when the virus is already inside you and replicating until it has reached enough amount to produce symptoms on you. And that's the time when you start realizing that, hey, you know what, I think I'm sick,
Yeah.
So, people don't take that into account. So
I'm interested here in what is the incubation period? What time span for incubation?
What time span? It's very different from one pathogen to another, from one virus to virus, bacteria,
All right, what's the least and what's the most?
In the case of corona, it's somewhere between 7 to 14 days. Right.
All right. Well,
you could still have that, or you could have the infection within the past, 7 days, but you don't have the thing. So this is why it's like right now, for example, if you have a contact with someone who is confirmed positive, for example, today, you meet a person, and then later on, for example, tomorrow, he told you that, I just tested yesterday and I'm positive. It is not advisable for you to get tested right away, because chances are, even if you got it from him, your test result would most likely show a negative sign, because it's not enough time for you it's not enough time for the virus to replicate to the level enough to be traced positive by the test. Does that make sense? So right now, the advised time to wait for you after the contact is at least 3 to 5 days after the last contact. At least you can wait a bit more, even a week, because those time are the incubation period. That is the interval from the pathogen, could be the virus or the bacterial, coming into your body, being accepted by one receptor, and then the time it needs to replicate in your body to the amount that is enough, the amount that is enough to be traced by a positive result or giving a symptom in you. Other bacteria, I'm going to give example, like, for example, chlamydia, for example. You could, the incubation period is quite long. It's somewhere between 2 weeks to 1 month. So you could get infected 2 weeks to 1 month ago and still not showing any symptoms until the next 2 weeks to 1 month, something like that. So those are the silent killer time. I would say that the incubation period, because you probably don't feel it, but the virus and the bacteria is working in your body.
When our Pembantu, she came to work. She was a little sick, but she thought it was a toothache. She thought her problem was a tooth, and she always wears her mask. She's very responsible, and then she went home, and I said, "Hey, let me know how you're doing." I stayed in touch with her, and so then she got sort of sick. So, she was throwing up and had a headache. So she and her husband and the kids all got tested, and they were all positive. So from the day we were with her on Monday, and I work right next to her quite a bit. You know what I mean? I come in and make tea, and she and I talk a lot. Because that's how I study Indonesian. It's by talking with the people I work with. I don't want anybody who speaks English or who will. So from that day, Katrinka and I quarantined for 1 week, and then we went to Global, where I miss you greatly, and got tested, the rapid antigen test, and that was negative. So that means unlikely. We have it, And then Katrinka started coughing for a week, and she went back a week later, and she had bronchitis. She wasn't positive. But anyway, now I'm working on music with some people, and Gus, who's the lead guitarist who plays with Tabasco Jam, Kim's band, and with her, just the two of them. His family's Pembantu got COVID, and the whole family quarantined for 2 weeks. He said 10 days at first. Well, wait a minute. No, I think they did 10 days. But then once the Pembantu tested negative, after I think they waited 2 weeks, she came back to work. Now, our Pembantu, I was more concerned about how she felt. I knew she'd be negative. I told her, don't come back until you're 100%, And so she's coming Monday. That's 3 weeks. And, we keep paying her if she's here or not. So,
that's very kind of you. That's great.
Yeah. Well, we're old, we've known them since we first arrived here. But now, one thing I've run into is Nyoman, he's a Bemo driver, who's been driving us for 7 years. You met him.
I did.
You met him.
And your dog, too.
I might. No, dog. And you talked to Nyoman about, I can't remember where to get vaccinated or something. And he really appreciated it. He was, he gets very shy around anyone he sees as an authority. But I noticed with him, and he's a little more kampung than a lot of the people I'm around. And I'm more country. And our gardener is very kampung. That they're terrified of the thought of Cadet coming back. And What I told our gardener, I said, you're more dangerous than she is. She just got tested negative and has a
Yeah,
certificate, whereas you just don't feel anything. You haven't been tested.
that's true. Yeah.
Uh, and so I'm going to tell Nyoman that. But if I have Nyoman and Kadek, we depend on both of them. We're around them a lot, and they're
Yeah,
around each
yeah.
other. If Nyoman's getting paranoid and irrational and hysterical, I would like to try to connect you with him because he respects you.
Oh, okay.
To
Yeah.
tell him to don't worry. Uh,
Yeah, we
all
can.
right. Well,
I
that's one
mean,
thing
I
I
mean, we
wanted to say.
can have
Yeah.
a talk with him and see how he feels.
Oh, I asked him to take some money over to them after her whole family was negative, and he was just terrified.
Oh, yeah?
She has a cousin who's Gojek, right? She sent him over, but I mean they needed it to
Yeah,
eat, you
yeah.
know. It was just ignorant of Nilma. That's all I could say. So look, you've got to go. You've given me more time than you had.
That's all right. But yeah, I have to go actually.
Yeah, this has been very helpful.
We can chat some other time too.
Keep studying, study hard, because I want to ask you more questions.
I think I have the I saw this post the other day. I think I will forward it to you.
Yeah.
The picture of so there's this doctor who's he has this account on Instagram, and he keeps on updating people on the newest whatever updates on COVID, including this percentage on what are the risk of you getting, I don't know, like blood clots or whatever from getting AstraZeneca?
Yeah,
or
like 1 in 250,000.
Yeah.
Exactly.
Exactly.
And I think the last I saw it was about 1 in 250,000.
Yeah.
Whereas the death rate was more like, I don't know, 1 in 1,000 or something.
I read it.
More than that.
I forgot the article, but it's like you have more risk of dying when you get in your car today, going on the street, rather than you getting vaccinated.
Yeah.
And the risk is multiplied by, I think, 3 digits, even 4 digits.
Yeah.
I find it really wow. When you put that in that perspective,
in
numbers.
Well, it's like people who are terrified of flying, whereas going to the airport is much more dangerous.
Yeah.
Yeah. Okay. Thank you very much. Oh, how do you like your new job? I just want to ask you, how do you like your new job? Is it all right?
Yeah, it is what I want to be doing, because I want to specialize in obstetric and gynecology.
So you're able to do that. You're able to do that. That's good.
Yes. Yes. So I'm on my way for my training right now. And for residency, I mean. So yeah, that's what I want to do. We also have a lot of cases. This is actually the interesting one. A couple of days ago, because I think it's been 2 or 3 weeks, maybe a month, that the Association of OBGYN in Indonesia has already released an advice that pregnant women should be vaccinated as well, pregnant women and lactating women. And it's been released by the WHO and everything as well.
Okay.
Right? But on the field, in real time, on the vaccination side, a lot of the vaccinators are still hesitant to give the shot to pregnant women, and we do see more and more numbers of pregnant women getting infected and falling into the severe category and even dying.
Yes.
and right now, if we have like pregnant women going into the hospital, but they're not in labor, they're in second trimester, for example, but they got COVID positive. It's that kind of case that we take seriously because especially during the first trimester, right? Like it's during the time where it has the highest chance of causing harm to the baby, especially.
Right. That's very good to know.
Yeah.
Katrinka was concerned when she saw that recommendation. So what you say, I think, she will appreciate. Yeah.
Yeah. Well, I think people are working on spreading the updates already for the vaccinator on the field, so they could, so they could actually just give the vaccination to the pregnant woman, because we still have a lot of pregnant women who are not vaccinated, and actually kind of dangerous. It's actually dangerous for them.
Yeah. Okay. Well, thanks a lot. Look, I could just keep asking questions, but I got to let you go.
All right, David.
Thanks a lot.
I'm
very glad to hear
care.
You're doing what you want. I wanted to know how it was all going. Yeah.
Yes.
Okay.
Yes, I really enjoy it.
Good.
Hey,
I like your new picture too.
It was taken during my birthday.
Wow.
I was in isolation during my birthday.
Really?
Oh my God.
Yeah. Well, it's a lot more. It's
turning 30 this year.
Oh, turning 30. It's pretty glamorous. Your last one was a little more professional. I like them both. I like them both. They're two sides of you. Okay.
All right, David. You have a good weekend.
Yeah, you
Send
too.
my greetings to Katrinka.
Yeah. Okay. Bye-bye.
Take care. Bye.
So thanks a lot, Dr. Raya. That was great. Really appreciate it. And I look forward to following up with you on all that. And I'll look into things a little bit, but I don't spend a lot of time. Reading about COVID. I just try to be careful. So this has been a Cuke audio podcast, another episode of Life in Bali. I'm DC, poohbah of Cuke Audio and Cuke Archives, coming to you from sleepy Sanur with Dogette Bandita, feline Cuchita, and dear lovely Katrinka. And we're wishing you and yours and all of us a grand awakening.